Thank you, Mildred. One can only tell the health status of a society by examining the health indicators, for example, about nutrition, birth and fertility rates, and mortality rates, among others. Uganda has not had a good record when it comes to maternal mortality rate. At least for the last 5 years, it has recorded about 16 women dying every day as they try to bring life on earth. However, the Uganda Demographic Health Survey of 2022 now shows that daily maternal mortality toll is 9 women, making the annual cumulative death toll of 3,000 women. Now, to understand what comprises these figures, let's take a deep dive into the National Annual Maternal and Perinatal Death Surveillance Statistics of the financial year 2023-24 and start with what is killing the 3,000 women per year. According to the Ministry of Health, the top 6 killers are hemorrhage or bleeding, which could be postpartum or antepartum, hypertensive disorders of pregnancy, commonly known as eclampsia, indirect causes including malaria, HIV and AIDS, TB and anemia, then pregnancy-related sepsis, ectopic complications, and abortion complications. Dr. Richard Mwesigye is the Assistant Commissioner in charge of reproductive and infant health at the Ministry of Health.
Bleeding for women now specifically is because of 2 things. One is the tears. Tears along the birth canal can bleed until all the blood is finished. At the cervix, in the perineal area, that one can cause severe bleeding. Number 2 is the uterus refusing to contract. When women deliver, that uterus of theirs is supposed to contract and go back to its original shape. So when that uterus refuses to contract, it is only the hospitals that can, health centers that can save you. Because for us, we have our science. We have medicine that can stop that bleeding. We have medicine that can force the uterus to contract.
To break it down further, you get to know who is actually dying. The National Annual Maternal and Perinatal Death Surveillance Report shows that the death is prevalent among women or girls who get pregnant below the age of 19. Why? The report further shows that the recorded first sexual encounter of females in Uganda is at 16 years. According to Dr. Mwesigye, when girls get pregnant below the average age of 19, they risk suffering serious complications that can lead to death. On a serious note, every year, 200,000 women suffer complications from which some of the 3,000 unfortunately die.
Please, women don't deliver from the villages. Even if we have told you 85% will deliver normally, because the time you get a complication, the health system is very far from you. We cannot respond. For example, if you started bleeding, you only have 2 hours to live. 1, 2. There must be a system that saves you within those 2 hours. If you develop high blood pressure, you only have probably 3 hours to live. 1, 2, 3. And life is gone.
The complications are also as a result of induced abortions, which were found to be at least 15% of the recorded pregnancies in 2023-24. And this is because such women and girls are trying to do away with unintended or unwanted pregnancies. About 700,000 babies born in Uganda every year are unintended, and studies have shown that a 62% fraction of the bearers of these children are actually adolescents. So now that we know who is actually dying behind the statistics, what is the Ministry of Health doing? Dr. Mwesigye says the critical intervention is to have every pregnant woman or girl access a health facility and be attended to by a qualified health worker.
85% of all Ugandans can access services within a radius of 5 kilometers. And we are very proud about that because we started with 60. The health facilities were very far, and we've really added a number of health facilities. In the last 5 years, probably more than 500. More than 500 facilities. Majority of the maternal and child health services are consumed in the government facilities, 80%. And the number has been growing because people have increased confidence. Our population has increased confidence that actually we offer a good service. We still have challenges, but we are offering a good service and a free service.
For these interventions, the report shows that the maternal deaths have since dropped to 82 deaths per 100,000 live births from 100 deaths per 100,000 live births 5 years ago. And this is because 80% of all deliveries have occurred in a health facility, especially the government ones.
Every mother who dies in Uganda in a health facility is audited and has an audit report. The reason for audit is not arresting health workers, but to learn from the gaps that probably happen. So that is why we are saying 100% of all women should deliver under skilled birth attendants.
Now you know beyond the figures. My name is Mwesigye for NTV.